I think the view on the organisation of healthcare itself has to change rather dramatically, and I've had several discussions about that with various people during the last 12 months, because one of the really interesting things is that there's lots of aged care facilities being planned, but not a lot of thought has been put into dental care at those aged care facilities. Because we've got all these people with teeth and the various issues that I just mentioned, the teeth falling apart due to fatigue, decay starting up again, and gum disease, and how they affect your general health, it's becoming a really big deal. The aged care facilities and the overall planning of health care, the delivery of health care, needs to take these factors into account. Just on the aged care facilities themselves, we're used to here having somebody brought in and they're escorted by one or two people depending on their state, and they're usually people that have been with the practice for many, many decades, probably back to the first prosthodontist in a few cases, and I'm the third. And that's a big manpower issue. And when I was talking to an owner of aged care facilities and his manager about this issue, his manager pointed out that it is a very expensive exercise for them with a patient who needs two people to escort them, to have those two people leave the facility, take the patient to the dentist, have the procedure done, and then bring them back. So you've essentially lost at least 1 day's worth of labour to move that patient, let alone the cost of the transport facilities. So when you look at it from that point of view, and look at the number of people that are going to be in retirement villages that can't easily move around, or in higher care, aged care facilities, then it becomes a big issue, a really big issue. And so that area in particular has concerned a number of us who are in the older group of practicing dentists, and how the country as a whole and individuals themselves are going to face up to that. A big political football match, because it's going to be expensive. And it's one of those things, when I was talking to a colleague who has a facility, it's one of those things where you're just going to have to accept that aged care facilities will have to have their weekly service fee increased so that the actual cost of the treatment doesn't become prohibitive. Because if you've got somebody who's nursing home bound, has a badly abscessed tooth or mouth from bad ulcers, you have a big medical problem. And it could make them very, very ill, require intensive care hospitalisation. Well, suddenly we're talking in tens of thousands of dollars a day for that sort of care. And so we've got to weigh up what's the better thing to do: spend the money to look after a lot of people, or spend a lot of money to look after one who gets really sick. So that's a big political decision that's going to have to be made. And of course, when we talk about politics and state and federal politics looking after healthcare, healthcare is expensive, and neither side really want to pay. So that's an interesting philosophical question that people are going to have to face up to, and we as a nation are going to have to face up to.